This video is for the section C, practical applications, and I'm going to concentrate mainly on the final question, so the 10 marker, which is asking you to use your psychological knowledge to describe and evaluate a suitable training, educational or treatment programme to manage the issue you have identified. And that question could be 2 6 markers, or 2 5 markers, one which says for you to describe it, one that says to evaluate it, or it could just be a big one like this. You treat it in exactly the same way. The marks are available, if it's like this, are 2 for AO1, what psychological theory is behind it. AO2 is for making suggestions, so 4 marks, and then AO3 is for evaluating what's good and bad about what you suggested, using terminology like ecological validity, reliability, ethics, and things like that. So, I mean, generally, this section, you're going to get an article of some kind, and in that article, you've got to suggest why it is relevant to that approach that it's talking about. So it will tell you what approach it wants. Then you'll briefly describe the course study and explain how it relates to the article. Then you'll mention kind of a psychological issue or an ethic or a debate or whatever it's asking you, and supporting it with evidence from the article. Sometimes they link those two questions together, so whatever the issue is there, they might get you to do a treatment programme based on it there. So you've got to really read all the questions and make sure that you're picking the right stuff. Because on one of the sample papers that we were given, this issue here that you identified, you have to then talk about in that one. And if you talked about something like, I don't know, situational dispositional debate in that one, you're not really giving yourself much to talk about in this one. But I mean, you know, if you'd said it was supporting the situational side, if it say it was the social approach that it was in, you might then talk about a treatment programme that focuses on the situational. So you could twist it so that you are still talking about it, but hopefully they won't do that, and they will just say, you know, just a generic treatment programme. So what I've done is I've put all the different approaches here, and I've put all the topics that these approaches are talking about. So we've got developmental approach, which is external influence on children's behaviour. So the samples that we've been given have been things like, it's going to be about some child of some kind. So it might be something like children wearing seatbelts, for example, or watching cartoons, like aggressive cartoons maybe. Aggressive cartoons. It's going to be something about children and something about that they do that then influences their behaviour. So there's going to be some kind of like adult there that could be affecting them in some way. Or it might, well, yeah, it's got to be children of some kind because the studies are about children or whatever. So kind of treatments that could be used, you can bring in things like social learning theory. You can bring in things like reinforcement. Because it's all about kind of like how that person affects them over time, but you know, social learning theory things and reinforcement things. So depending on what it's about, you know, if it's like seatbelts, then you know every time the child wears a seatbelt, well, in fact, you'll model the behaviour, won't you? First, you'll pretend, not pretend, but like you'll put your seatbelt on, and you'll make a big fuss about it, so the child sees it, observes it, imitates it, and then you know, you might give them a reward every time they've got the seatbelt on, or you might say that they're grounded every time they don't wear their seatbelt, you know, something like that. So you talk about you've got like 4 AO2 marks, so you kind of need to suggest like, you know, 2 or 3 things that you could do. I mean, 4 is obviously better, but I think you're getting a mark for suggesting something and explaining it. So you only really need 2 main things, but 3 just to be safe. And then you're evaluating them. So you know you could be saying things like, you know, the positive change in behaviour for a start. You know, if that works, then you know it's quite valid. But you might say, you know, if you've done some training kind of program, that we'll come back to that because then that's like, yeah, we'll come back to that. I might just merge them because they'll be quite similar. Understanding disorders, it's going to be, you know, there's going to be something about maybe somebody, someone not understanding communication, like with autism, or it might be someone has a phobia. Um, so your treatments, if they're going to be things like therapy, um, things like systematic desensitization, flooding maybe. Um, it could be things like reinforcement. Reinforcement. It could be a no. What could be like it's got to be like an individualized treatment program, because you're looking at the person's individual differences. Um, you could so that's kind of like stuff for phobias, like autism, what we said about the communication problems. So might be kind of things like um, communication problems. How could you could give them training in spotting facial expressions, so some kind of like brain training for it. So like how to get maybe theory of mind, maybe people with autism just haven't developed it enough. They just need some extra, because people who are older with autism find things like jokes and things like that, joke training. They find it easier to understand when they're older, when they've learned about it. So maybe that would help them integrate socially because they've learned it. So maybe it's not a natural thing that they can get on their own, but with training they can maybe understand it. So like, they might not understand the joke, but they understand that it's funny when someone says that joke. So then they integrate better with society. So you've talked about all those different things. Examples of cognitive memory, it's going to be something to do with, like, I think the sample one was that a teacher couldn't remember a list or something like that, or it might be something to do with different contexts. It could be to do with eyewitness testimony. Eyewitness testimony. So like what would you do? So like a teacher can't remember a list. Again, you could have some training, or you could just training. It might say something like, I mean, it's very, very unlikely because the studies don't really link to it, but maybe with cognitive they'll say something like anxiety, which is caused by automatic negative thoughts. That's one explanation. So maybe like a treatment program would be cognitive behavioural therapy, where thoughts are challenged. So whatever their thoughts are, even if it's just things about, let's say if it's about memory though. It's about memory. You can't really have cognitive behavioural therapy for memory. That doesn't make any sense. But obviously, they could ask you anything, couldn't they? Really. But I would assume that it's going to be about memory because that's the topic that it's in. I think I'm just overcomplicating it. But training to make your memory better. You might say things like the same context, things like that. Responses to people in authority. There's going to be some kind of like army situation, or some like parenting situation, or a teacher, or management boss of some kind. Anyone that's in authority in that kind of way. So your treatments, obviously it might not be treatments, it might be like education or training programs. So it could be things like not abusing authority, or it might be it could be like about whistleblowing. So it might be things like how to make someone feel more comfortable whistleblowing. So like a policy in the company, or like an anonymous box, like something that they could do so that they don't feel like they calm the blow. Or like how to actually make them obey. So it could be like things like having an authority figure be consistent in commands. Like you must continue, like another experiment. Um, um, what about dreams of the brain? So this is going to be something like, I think one of the sample ones, or one that was in a textbook that I saw recently was about split brain and somebody with split brain. Oh no, it wasn't. It was about split brain, but it was about having a stroke in the left hemisphere, and explaining like how to rehabilitate them. Rehabilitate, because obviously you're gonna have to focus on language stuff, because that is what's going to be the problem if it's in that area. Other things like low and high delayers, wasn't it? So low and high delayers. So it's going to be inferior frontal gyrus and ventral striatum. So maybe things like how to, so again, like brain training to like develop those areas, maybe, or reduce like the ventral striatum. So you need to like brain training to develop the inferior frontal gyrus, because that's the one that's like in control and you've been more successful and stuff. Usually within biological you kind of like do drug treatments, but none of the studies have looked at drugs and things like that, so that's not really going to be anything. It might be rehabilitation of people with split brain, like what you're going to do, things like make sure they use both eyes and cross over the visual field. Obviously it really depends on what they're going to give you. I don't know if they're going to give you anything on behaviourists and psychodynamic. It would be very odd, but like treatments for because that, I mean, there isn't an actual topic for these, because this is just like the spec is very kind of, it doesn't have specific studies that go within it, but you can view any study from those perspectives. Like I guess like it would be very odd for them to ask you a section C question on behaviour or psychodynamic, just because the spec doesn't say that it's in as much detail as the other ones, but they might do. So let's say treatments would be like free association. You just write down anything to get everything out of your unconscious mind. It could be psychoanalysis, could be dream analysis, it could be hypnosis, anything that really accesses your unconscious mind. Examples of what they might give you might be that I don't know, they've got maybe a phobia, maybe some kind of disorder, maybe some mental health thing, like mental health issue. They're not sure why, or they're feeling angry, they don't know why. Behaviourist, again, that could be a phobia. It could be things like aggression. It could be adherence to medical regimes. That one could be adherence as well. So again, this, your treatments are going to be conditioning treatments, so like classical and operant. reinforcement through that with operant conditioning. Systematic desensitization is therapy for that. So there's kind of like all kind of like treatments and things that you can do. And then in terms of like evaluation, you've got positive changes. You might say things like mundane realism, perhaps lacks not really like the real world. So say you've suggested something like, you know, they're gonna watch this one here, like could have a role play video, a role play or a video, you know, of somebody doing an act or whatever, then that might not be like the real world. So it's not a normal task, so it's not going to rehabilitate them, it's not going to treat them in any way. Or you might say that it lacks ecological validity because, you know, it might work while they're there in a therapy session. It's linked to mundane realism, it might work, but then not in the real world. It won't work in the real world. You might say, you know, it's not ethical to do it. You might say that, what else could you say? It's quite reductionist because it's, you know, not considering other explanations for behaviour. It's quite deterministic, as, you know, doesn't suggest free will. You could say that it's scientific if it's like a treatment for like biological or behaviourists. They're quite scientific. They use laboratory experiments and maybe cognitive as well. But then, you know, cognitive isn't scientific because it's not tangible. So you could say scientific, or you could say unscientific, dependent on what it was. So then that links again to validity. Valid or not. What else could you say? You could say things like socially sensitive. That could probably link with ethics. What other things have we got? Reductionism, determinism, validity, deterministic, scientific. I mean, their treatment educational training program is going to be like, you know, does it work? Does it not work? You only actually need like maybe like 2 strengths and 2 weaknesses at the most. You're only getting, is it 4? Yeah, you're only getting 4 AO3s. So really, it's only like 4 comments that you need to make, and they don't even need to be in that much detail really. Or you could do like 3 really good ones, if you run out of time. So any other, you could talk about ethnocentrism. You know, it might work for that person, but not for you. Or individual differences is another one I was going to do. Individual differences, so it might not work. So there's lots of different things that you can say good and bad for it. What's it saying here? Reliability, whether it's reliable or not. You could say time and expense, you know, is it actually practical to do it? You kind of want to try, you know, if you're suggesting a treatment program, educational program, or training program, whatever it is, it's got to be kind of positive. It's got to be a good thing. There's no point suggesting something that's rubbish. So when you are evaluating, you need to kind of focus on, okay, it is good for all these reasons, but then say, however, there could be these problems with doing it. So you are saying the bad things, but your focus is on the good things because you've suggested this. So, you know, if it's rubbish, why have you suggested it? It doesn't make any sense. So you've got to kind of focus on the strengths of it and then kind of say, however, there could be these problems with it. So hopefully that will give you, you know, some ideas of what you can do with this question. I'll put it on the Google Drive so that you've got it. If you've got any questions, just let me know.